You're listening to localwebradio.fm.
Welcome to the Healthy Smiles Oral Health Show with Dr. Norm Ickert. Brought to you by Ickert Dental Implant Center, where they are committed to providing you with the very best in modern and advanced dentistry. Now, here's your host.
Hello, this is Nick Jaworski, and I am your host today, and I am here with Dr. Norm Ickert, director of the Ickert Dental Implant Center, and today we're continuing our conversation about dental implants and patient care. And Dr. Ickert will discuss what dental implants are made of and answer common questions, including how to know if dental implants are right for you. Now, before Dr. Ickert joins us, just a reminder that if you have questions or require assistance, you can call Dr. Ickert's office at 604-881-1381. That's 604-881-1381. Dr. Ickert, it's great to be talking with you again today.
Thank you, Nick. Nice to be here.
All right, now we've got to pick up where we left off. We were talking about osteo-integrated dental implants in the last episode. And just to sort of catch us up, what does that mean when we talk about an osteo-integrated implant?
Well, I think the best way to look at it is that the part of the tooth that is below the gum line is the root. And what an implant really is a replacement of the root portion of the tooth. And it's like a little anchor that gets screwed into the jawbone, and then through the magic of osseointegration, which is the body's ability to accept the titanium and grow towards it and make it a stable connection, will then allow anything to be connected to this anchor to replace whatever is missing in the particular patient's mouth.
All right, so yeah, we've got that first step. We've got this anchor put in there, and now I guess we left it off last time. We didn't talk about the role of implants and who might benefit from implants. And I guess, how do we know if you're a good recipient for a dental implant?
Well, I think that everybody knows somebody who is missing a tooth, either through an accident or possibly even disease, or possibly like something like decay, or maybe even a tooth that was congenitally missing that never actually came into the mouth. So all of these situations are potential good opportunities for someone to consider dental implants. Because it doesn't matter if the tooth is being lost from decay or gum disease and it has to be removed, or if the tooth has been missing for a long period of time with its corresponding gum and bone loss, which we talked about in earlier sessions. Today, there are so many techniques that are so advanced and so accessible to the average patient that we can regrow bone, we can regrow gum tissue, we can put implants into the bone and replace whatever is missing with a high degree of predictability. So it's really a very exciting time in dentistry.
Yeah, and everything that we've talked about has been just this remarkable story about the progress of science and our ability to give us back our smiles and our health and our oral health. And I assume that if there's a situation I have with my teeth and I'm wondering if implants are right for me, that I could just go to any dentist and they could help me out.
Well, in theory, that's true, but I think that truthfully, it's important that one looks for a dentist who is at least familiar with dental implants. Now, they don't necessarily have to do the surgical part or even the prosthetic part, but it is important for a dentist to be knowledgeable about dental implants, to even provide the proper information or even the proper referral source for this procedure. Because as we know, the procedures in the past to replace missing teeth were often to cut down healthy tooth structures adjacent to the missing tooth and insert a so-called bridge, which could be cemented in. And that was a fine restoration. But today, most people are very reluctant to cut down healthy tooth structure. And so there are dentists around, of course, who are very comfortable with these procedures and may not be quite so comfortable with implants. So what I'm trying to say is that it's just important to search out an office that is comfortable with this, or at least do the homework on the internet or elsewhere so that you know what your options are.
Yeah, I wanted to make sure that not that they would perform necessarily the procedure, but that they would be able to push you in the right direction, perhaps. But it's good to know that if I'm sitting at home wondering if this is for me, that I should just go straight to the source, to somebody who specializes in this.
Yeah, and today with technology the way it is and social media and all the access that we have, I mean, it doesn't take very much to Google dental implants and in the area that you might be, and names will definitely come up that will help you make some decisions where to get this information. And hopefully the general dentist that the patient is a part of will be able to provide that information, and if not, will certainly refer the patient to the proper source for that.
Now, is there ever a time where there might be space for an implant, but it isn't appropriate to go forward with that?
Absolutely. I mean, it really isn't any different than a hip implant or a knee implant. Certain conditions have to be present in order for an implant to be successful. Now, it's really quite amazing that the majority of patients, if they can walk into your office and they can breathe on their own, for the most part, dental implants will work for them. Right. Now, of course, that's a bit of a gross exaggeration, but it really is amazing how well these implants do integrate in the majority of patients. Now, there are some significant risk factors that we need to address. For example, if a patient has uncontrolled gum disease, that bacteria that leads to that gum disease will still be present even after the tooth has been removed, and it could still put that implant at risk. So it's really important that active disease be brought well under control before implants are considered. Or if a patient has an autoimmune disorder that might compromise the so-called foreign body response to something like an implant, that could potentially affect the success rate. And someone who might have uncontrolled diabetes, which we know is a disease that really affects the healing potential. That is something that would have to be taken into consideration as well. So there are definite situations where dental implants need to be really looked at carefully before they are placed. Another example would be smoking. There is definite science to tell us that more than 10 cigarettes a day will increase the risk of implant failure, not just at the time of placement, but even late implant failure. In other words, years down the road, these implants become at much higher risk of failure.
Oh, wow. And of course, this is, if I've learned anything from this process, this is a good reason to go through a step-by-step thorough examination before undertaking procedures like this.
Yes, Nick. And now I think it seems to make more sense as we develop this series of podcasts that we did start with the whole concept of oral health and what is a good oral exam, because it really does start with that, because it really isn't the implant that's the magic. It's the understanding. It's the diagnosis. It's understanding why something is the way it is that we can then provide the proper treatment recommendations. And so a thorough exam, starting from the outside in and checking the lymph nodes and checking the soft tissues and checking the maximum opening, and all these things really play a huge role to determine if dental implants are a suitable option for the patient.
Okay, well, we have to take a quick break. It's been great so far. And when we come back, we're going to be talking about scenarios in which dental implants are useful. So don't go anywhere. We'll be right back.
More Healthy Smiles with Dr. Norm Ickert from Ickert Dental Implant Center after this.
If you've been known to enjoy a nice glass of wine, be sure to tune in to From the Vine to the Wine with Matt Berzovich on the Lifestyle channel on localwebradio.fm. If soccer is a part of your life on the Semiahmoo Peninsula, be sure to tune in to This is Soccer with Chris Murphy, Executive Director for Coastal FC on the community channel on localwebradio.fm.
Would you like to get more from the devices you own? Not quite sure where to start? There is help. Catch Powering Up for Non-Techies with Justin Martell. computer department manager at London Drugs, on the specialty channel on localwebradio.fm.
It's time now for more Healthy Smiles with Dr. Norm Ickert.
And we are back, and I am still here with Dr. Norm Ickert, and we're talking about dental implants. And now, Dr. Ickert, what are some scenarios where dental implants can be used?
Well, let's start with the most obvious one, and that is when a single tooth is missing. Mm-hmm. And that can either be in the front of the mouth or in the back of the mouth. Now, if it's in the back of the mouth, it becomes a little bit more routine because it's mostly a procedure that's done for improving the function of the chewing ability.
Right.
And it's not so much aesthetically driven. Whereas if you replace a tooth in the front of the mouth, I would say a higher degree of complexity because now all of a sudden we have to not just worry about the implant being stable, but it actually has to look good. And that's easier said than done because, as we said in earlier podcasts, when a tooth is removed or a tooth is lost, it's not just the tooth that's lost, but there also is a portion of the gum and the bone that is lost as well. It's remarkable to note how critical this little extra volume of gum and bone really is to end up making something look really good. And just to say it sort of in a very, I would say, graphic manner, if you had the need for replacement of an amputated lower limb, in other words, the leg below your knee, you would be quite happy just to have a prosthesis that would work and not worry so much about how it would look because you can always wear long pants and it would never be an issue. So you'd be concerned more about function and not aesthetics. Now, if you had a missing eye, you would just be concerned about having the best artist in the world fabricate that glass eye because all you'd be concerned about is it for it to look good, but you wouldn't expect to see, in other words, aesthetics and not function. But when we deal with a tooth in the front of the mouth, we actually have to deal with both. The function and the aesthetics. And that's what makes it so incredibly challenging and difficult, and oftentimes difficult for patients to understand, like, why do we have to do all this work just for a simple implant? But in the front of the mouth, it is critical that we rebuild the tissues, whether they're hard and soft tissues, to try and closely simulate what used to be there. And that is what makes the ultimate implant treatment successful.
Now, what about when there's more than one tooth?
That's the beauty of dental implants, that we don't have to actually replace each tooth that's missing. So if you have, let's say, for example, 3 teeth missing, we probably only need 2 implants, and we could build a nice 5-unit bridge on 2 implants. It's now been proven that implants that are well integrated are totally capable of handling those kind of loads. So instead of having to put 5 implants in, you only have to put 2 in, but you get the benefit of 5 teeth that could be placed on top of those 2 implants.
Well, that's amazing. Now,
and another thing, sorry, Nick, another thing that really is cool is that people oftentimes present to the office that have a partial denture, but they hate their partial denture. A partial denture is a removable appliance that is a piece of plastic, or maybe it even has a metal framework. Oftentimes it has little metal clasps that surround the neighboring teeth. And quite often patients are very uncomfortable with these partial dentures, and they tend to rock the adjacent teeth loose. Well, the nice thing about this is that you can put in maybe just 1 implant on either side and now put a little connecting piece into that partial denture, which snaps on top of that implant and provides amazing support without rocking the adjacent teeth loose. So there can be an incredible increase in function for these patients without a very significant cost involved compared to a more elaborate treatment. So sometimes it's just a simple treatment that can make a huge difference for that patient.
Yeah. Now what about when we're missing just a lot of teeth?
Well, when we're missing a lot of teeth or even a complete arch of teeth, like mentioned before, we will oftentimes only need 4 to 6 implants to actually replace that entire arch. And that can be done with an appliance that is either removable or it can be done with an appliance that is fixed. In other words, that is screwed or cemented in. And that just depends on the patient's preference or sometimes even the anatomical situation. There are various options available.
Now, and we talked about this briefly before, but I think the thing that is most interesting to me is this combination of aesthetics and function and the durability of these implants. It seems like a very exciting field to be in, to be able to provide sort of something that is going to work and also look good and bring people their confidence back.
Absolutely. And aesthetics and function are two key issues that we as human beings really desire. And to be able to provide that in a predictable manner is extremely rewarding, not only for the practitioner and the entire team, but of course, most importantly for the patient who can now have their function and their aesthetics and most importantly, their confidence restored. It's a wonderful, wonderful service to provide.
Okay, well, it looks like that we are out of time, unless you have any final thoughts you'd like to share with us.
I think, Nick, we've covered this very thoroughly, and on the next podcast, we'll go into more details on other aspects. But again, the ability to be able to restore the confidence through the use of dental implants, giving aesthetics and function back to the patient is, as the old commercial says, priceless.
All right. Well, that's a great place to stop. And if you know someone who would benefit from what we have talked about here today, please go ahead and share this podcast with them. There's a lot of great information here. And you can always reach Dr. Ickert at www.ickertdentalimplants.com. That's ickertdentalimplants.com. Or you can reach him by telephone at his office at 604-881-1381 or toll free at 1-866-931-1981. Dr. Ickert, thanks so much.
Thank you, Nick. I really enjoyed it.
Thanks for listening. At Ickert Dental Implant Center, we are committed to providing you with the very best in modern and advanced dentistry. If you would like more information about dental implants and our extensive range of specialized dentistry services, please call us today at 866-981-1381. That's 866-981-1381. Or visit us on our website at www.ickertdentalimplants.com.
Local stories, local voices. We're localwebradio.fm.
This episode is a production of Jam Media. For information on hosting your own web radio show, visit jammedia.com. That's www.jambmedia.com.
The opinions expressed by our guest and host on localwebradio.fm do not necessarily reflect the views of Jam Media or its owners. No expressed or implied opinions of any product or service should be considered an endorsement or recommendation of any kind by Jam Media or its owners.